You know that feeling when you take off your socks at the end of the day and you see those deep grooves carved into your ankles? Or when you press your finger into your ankle and it leaves an indentation that just stays there for way too long? If you're over 60, you've probably been told this is a heart problem. Your doctor might have even put you on diuretics or started talking about heart failure. But here's what almost nobody is telling you, and this is going to sound shocking, but in most cases, those swollen ankles have absolutely nothing to do with your heart. I'm Dr. Tasuku Honjo, and today I'm going to show you the real culprit behind ankle swelling after 60, and more importantly, I'm going to teach you a simple 5-minute habit that can drain that fluid and get you back to feeling like yourself again. So if you've been struggling with swollen ankles, if you've been frustrated because nothing seems to work, or if you're tired of being told it's just part of getting older, stay with me because what I'm about to share could change everything. Let me tell you about something that happened in my clinic just last month. A woman came to see me, 72 years old, and she was absolutely convinced she was in heart failure. Her ankles were so swollen she couldn't wear her regular shoes anymore. She'd been to 3 different doctors, had echocardiograms, stress tests, blood work, the whole 9 yards. Everything came back normal. Her heart was fine. Strong, actually, for someone her age. But her ankles kept swelling, and she was terrified. She couldn't understand why her heart tests were normal, but she had this classic sign of heart failure. And this is exactly the problem. We've been conditioned to think that swollen ankles automatically mean heart problems, especially as we get older. But the truth is far more complex and actually far more hopeful than that. Your body has a second circulatory system that most people have never even heard of. It's called the lymphatic system, and after the age of 60, this system starts to slow down dramatically. Think of your lymphatic system as your body's drainage system. While your blood vessels are like highways carrying nutrients and oxygen to your cells, your lymphatic vessels are like the cleanup crew, collecting all the waste, excess fluid, proteins, and toxins that accumulate in your tissues. This system is absolutely crucial, but unlike your heart, which pumps blood automatically, your lymphatic system doesn't have a pump. It relies entirely on movement, muscle contractions, and specific techniques to keep fluid moving. And here's the kicker. As we age, we move less. We sit more. Our muscle tone decreases. And suddenly, this drainage system that's been working perfectly for 6 decades starts to back up. Now, I want you to imagine your lymphatic system like the plumbing in an old house. When the house is new, everything flows perfectly. Water drains quickly, there are no clogs, everything works as it should. But over time, things slow down. Sediment builds up. The pipes don't drain as efficiently. It's not that the pipes are broken, they just need some help to work properly again. That's exactly what's happening in your legs after 60. The lymphatic vessels are still there, they're still functional, but they've become sluggish. Fluid starts to pool in your ankles and feet because gravity pulls it down, and your lymphatic system isn't strong enough to push it back up against gravity without some help. Now let me be very clear about something important. I'm not saying that swollen ankles are never related to heart problems. Of course they can be. If you have swollen ankles along with shortness of breath, especially when lying down, if you're experiencing chest pain, extreme fatigue, or if the swelling came on very suddenly, you absolutely need to see your doctor right away. Heart failure is real and it's serious. But what I'm saying is that the vast majority of people over 60 who have chronic ankle swelling, especially if it's worse at the end of the day and better in the morning, especially if it improves when you elevate your legs, that's not your heart. That's your lymphatic system crying out for help. So how can you tell the difference? Heart-related swelling usually affects both legs equally and often comes with other symptoms. It tends to be consistent throughout the day, though it may worsen in the evening. Lymphatic swelling, on the other hand, is often worse in one leg than the other. It's dramatically better in the morning after you've had your legs elevated all night, and it gets progressively worse as the day goes on. If you press on it, it leaves that indentation I mentioned earlier. We call that pitting edema. And here's something really interesting. Lymphatic swelling often starts in the feet and ankles and can creep up the leg over time if it's not addressed. You might notice your shoes getting tighter throughout the day or your legs feeling heavy and achy by evening. The woman I mentioned earlier, once I explained all this to her, it was like a light bulb went off. She realized that her swelling was always better in the morning, always worse after she'd been sitting watching television in the evening, and definitely worse in her right leg than her left. Classic lymphatic congestion. And the beautiful thing about lymphatic swelling is that it responds incredibly well to simple interventions. You don't need medications with side effects. You don't need expensive treatments. You need to understand how to activate your lymphatic system and get that fluid moving again. So let me teach you the 5-minute habit that can transform your swollen ankles. This is based on the principles of lymphatic drainage, which has been used in Europe for decades but is still relatively unknown here. The technique I'm going to teach you combines specific movements, positioning, and muscle activation to literally pump the fluid out of your legs and back into your central circulation where it belongs. And the best part? You can do this while watching television, reading a book, or just relaxing. It takes 5 minutes, and if you do it consistently, you're going to see a dramatic difference in your ankles. Here's what you're going to do. First, you need to understand that your lymphatic system flows in one direction, always toward your heart. So we're going to work from the top down to open up the pathways, and then from the bottom up to push the fluid through those pathways. Lie down on your bed or on the floor with a couple of pillows ready. I want you to start by taking 5 deep belly breaths, and I mean really deep. Put your hand on your stomach and feel it rise with each inhale. This is crucial because deep breathing creates pressure changes in your abdomen and chest that actually pull lymphatic fluid upward. It's like priming the pump. Your diaphragm is actually one of the most powerful lymphatic pumps in your body, but most people breathe so shallowly that they never activate it. So 5 deep breaths in through your nose, really expanding that belly, and out through your mouth. Now, still lying down, you're going to prop your legs up on those pillows so your feet are higher than your heart. Not just a little bit higher, really elevated. The angle should be at least 45 degrees if possible. Gravity has been working against you all day, pushing fluid down into your ankles. Now we're going to use gravity to our advantage and let it help drain that fluid back toward your heart. While your legs are elevated, I want you to do ankle pumps. Point your toes away from you, really stretch, then flex them back toward you as far as you can. You should feel your calf muscles working. Do this 20 times, nice and slow, really squeezing those calf muscles. Your calf muscles are called your second heart because they're incredibly effective at pumping blood and lymph back up your legs. Every time you contract them, you're squeezing those lymphatic vessels and pushing fluid upward. After 20 ankle pumps, keep your legs elevated and do ankle circles. Rotate your feet in big circles, 10 times in one direction, 10 times in the other direction. This movement stimulates all the lymphatic vessels around your ankles and helps mobilize that stuck fluid. You might even hear some cracking or popping. That's totally normal. You're moving joints and tissues that have probably been stagnant for a while. Now here's where it gets really effective. Still with your legs elevated, I want you to do what I call the lymphatic squeeze. Starting at your ankle, use both hands to gently but firmly squeeze all the way around your ankle. Hold for 3 seconds, then release. Move up a few inches and squeeze again. Keep doing this, working your way up your calf, past your knee, up your thigh, all the way to your hip. You're literally squeezing the fluid upward through the lymphatic vessels like you're squeezing toothpaste out of a tube. This manual lymphatic drainage is incredibly powerful. Do this squeezing technique on both legs, and then finish with 10 more ankle pumps and 5 more deep belly breaths. The whole sequence takes about 5 minutes. That's it. 5 minutes of lying down with your legs elevated, doing these simple movements and this manual drainage technique. But here's the secret. You have to do it every single day. Consistency is everything with lymphatic health. Your lymphatic system doesn't have a memory. It's not going to suddenly start working better on its own. You have to actively support it every single day. Now, that woman I told you about, she started doing this technique every evening before bed, just 5 minutes. Within 3 days, she noticed her ankles were less swollen in the morning. Within a week, she could wear her regular shoes again. Within 2 weeks, the swelling was reduced by probably 70%. She couldn't believe it. She'd been suffering for months, convinced she had heart failure, and this simple 5-minute habit changed everything. And she's not unique. I've taught this to hundreds of patients, and the results are consistently remarkable. But I want to give you even more tools because the 5-minute habit is your foundation. But there are other things you can do throughout the day to support your lymphatic system. First, you need to move more. I know that sounds obvious, but it's crucial. Every time you walk, every time you move your legs, you're activating those muscle pumps that move lymphatic fluid. You don't need to run marathons. Just walking for 10 or 15 minutes several times a day is incredibly beneficial. If you have a sedentary lifestyle, if you sit for long periods, your lymphatic system is basically at a standstill. Set a timer to get up and walk around for just 2 or 3 minutes every hour. That's all it takes to keep things flowing. Second, watch your salt intake. Excessive salt makes your body retain water, and that extra water has to go somewhere. It often ends up pooling in your ankles because that's the lowest point in your body when you're standing or sitting. You don't have to eliminate salt completely, but be mindful of processed foods, canned soups, restaurant meals, and salty snacks. These can contribute significantly to fluid retention. Instead, focus on getting enough potassium from foods like bananas, sweet potatoes, and leafy greens. Potassium helps balance sodium and supports healthy fluid levels in your body. Third, hydration is paradoxically important. I know it seems counterintuitive. You have swollen ankles full of fluid. Why would you drink more water? But here's the thing. When you're dehydrated, your body holds on to every drop of water it can, including in your tissues. When you're well hydrated, your body feels safe to release excess fluid. Plus, your lymphatic system needs adequate hydration to flow properly. Think of it like a stream. A dehydrated stream becomes muddy and sluggish. A well-hydrated stream flows clear and quickly. Aim for at least 8 glasses of water a day, more if you're active or it's hot outside. Fourth, consider your footwear. I see so many people, especially women, wearing shoes that restrict circulation. Tight shoes, high heels, shoes with constricting straps around the ankle, these all impede both blood flow and lymphatic flow. Wear comfortable, supportive shoes with good arch support and plenty of room for your feet to move naturally. And when you're at home, go barefoot as much as possible and do some toe spreading exercises. Spread your toes wide apart, hold for 5 seconds, relax, repeat 10 times. This stimulates the lymphatic vessels in your feet. Fifth, compression socks can be incredibly helpful, but you need to use them correctly. Get graduated compression socks, which means they're tighter at the ankle and gradually less tight as they go up the leg. This design promotes upward flow of both blood and lymph. Put them on first thing in the morning before you get out of bed, before gravity has a chance to pull fluid down into your ankles. Wear them throughout the day and take them off when you're ready to do your 5-minute evening drainage routine. Don't wear them to bed unless your doctor specifically tells you to. Your legs should be elevated at night anyway, so you don't need compression while sleeping. Now, let me address something important. Some of you might be thinking, well, I'm already on diuretics for my swollen ankles. Should I stop taking them? No, absolutely not. Never stop a medication without talking to your doctor. But what I will say is this, diuretics work by making your kidneys excrete more water. They can reduce swelling, but they don't address the underlying problem if that problem is lymphatic congestion. They also come with side effects like electrolyte imbalances, dehydration, and increased urination that can really impact your quality of life. If you start implementing these lymphatic drainage techniques and you notice significant improvement in your swelling, have a conversation with your doctor about whether you still need the diuretics or if the dose can be reduced. Many of my patients have been able to reduce or eliminate their diuretics once they got their lymphatic system working properly again. I also want to talk about diet for a moment because certain foods are naturally supportive of lymphatic health. Foods rich in antioxidants help reduce inflammation in the lymphatic vessels, making them more efficient. Berries, dark leafy greens, green tea, these are all excellent. Omega-3 fatty acids from fish like salmon or from walnuts and flax seeds, these reduce inflammation throughout your body, including in your lymphatic system. And here's something interesting, certain herbs have been traditionally used to support lymphatic flow. Red clover, cleavers, and calendula have all been used in herbal medicine for lymphatic congestion. You can find these in tea form at health food stores. I'm not saying they're magic bullets, but they can be a helpful addition to your overall lymphatic support strategy. Another thing that's incredibly beneficial is dry brushing. This is an old European technique that's gaining popularity. You take a natural bristle brush, and before you shower, you brush your dry skin in long strokes, always toward your heart. Start at your feet, brush up your legs, then your arms, your torso, everything moving toward your heart. This stimulates the lymphatic vessels that are right under your skin and helps mobilize fluid. It also exfoliates your skin and feels really invigorating. It takes about 3 minutes and pairs beautifully with your 5-minute evening drainage routine. Now, some of you might be dealing with more severe lymphatic issues. If your swelling is very significant, if the skin on your legs feels hard or thick, if you've developed skin changes or wounds, you might have a condition called lymphedema. This is more serious and requires professional treatment. A certified lymphedema therapist can provide specialized manual lymphatic drainage massage and fit you for professional-grade compression garments. This is beyond what you can manage on your own, and you should definitely seek professional help. But for the vast majority of people over 60 with mild to moderate ankle swelling, the techniques I'm teaching you today are going to be incredibly effective. Let me paint a picture of what your life could look like a month from now if you commit to this 5-minute daily habit. You wake up in the morning, and instead of your ankles already feeling tight and swollen, they feel normal. You put on your favorite shoes, the ones you haven't been able to wear in months, and they fit comfortably. You go through your day, you're walking more because your legs don't feel as heavy and achy, you're drinking plenty of water, eating foods that support your lymphatic system, maybe doing a little dry brushing in the morning. In the evening, you take 5 minutes for your lymphatic drainage routine. It becomes as automatic as brushing your teeth. And at the end of the day, when you take off your socks, there might be slight indentations, but nothing like before. Your ankles look relatively normal. You can see your ankle bones again. That constant discomfort, that heaviness, that worry about what's wrong with your body, it's gone. This is not a fantasy. This is what happens when you support your lymphatic system properly. Your body wants to heal. Your lymphatic system wants to work efficiently. It just needs your help, especially after 60 when things naturally slow down. And the beautiful thing is, these techniques don't just help your ankles. When you improve your lymphatic flow, you're supporting your immune system because your lymph carries immune cells. You're reducing inflammation throughout your body. You're improving your skin health. Many people report feeling less bloated, having more energy, even sleeping better when they start taking care of their lymphatic system. It's one of those beautiful interventions where supporting one system creates positive ripple effects throughout your entire body. I want to emphasize one more time how important consistency is. I've had patients try this for a day or two, not see dramatic results, and give up. Remember, the swelling in your ankles didn't develop overnight. Your lymphatic system has been sluggish for months or years. It's going to take a little time to retrain it and get things flowing properly again. Commit to 30 days of the 5-minute daily drainage routine. Put it on your calendar. Set a reminder on your phone. Make it non-negotiable. I promise you, if you do this consistently for 30 days, you will see a significant difference in your ankle swelling. And if you're someone who's been told your swollen ankles are just part of getting older, that there's nothing you can do about it, I want you to hear this. That is absolutely not true. Yes, our bodies change as we age. Yes, systems slow down. But that doesn't mean we're powerless. There is so much we can do to support our bodies, to work with our physiology rather than against it, and to maintain our quality of life at any age. Your swollen ankles are not a life sentence. They're not something you just have to live with. They're a sign that your lymphatic system needs support, and now you know exactly how to give it that support. Before I go, I want to leave you with one final thought. Your body is constantly communicating with you. Swollen ankles are a message. For too long, we've been interpreting that message as something scary, as heart failure, as inevitable decline. But what if we start interpreting it differently? What if swollen ankles are simply your body saying, hey, I need a little help here. My drainage system is backed up. Let's work together to fix this. That shift in perspective from fear and helplessness to understanding and empowerment, that's where real healing begins. So here's what I want you to do right now. Don't wait until tomorrow. Don't wait until you have the perfect setup. As soon as you finish watching this video, lie down, elevate your legs on some pillows, and do those ankle pumps. Do those ankle circles. Try that squeezing technique I showed you. Just 5 minutes. See how it feels. Notice the difference. And then commit to doing it every single day for the next 30 days. Take a picture of your ankles today so you have a baseline. Take another picture in a week, in 2 weeks, in a month. Document your progress. And come back and let me know how it goes. Leave a comment telling me about your results, because I genuinely want to know. Your success inspires other people who are struggling with the same issue. Thank you so much for watching today. If you found this information valuable, please give this video a thumbs up and subscribe to the channel, because I'm going to continue bringing you practical, science-based information that helps you take control of your health at any age. Remember, getting older doesn't mean giving up. It means getting smarter about how we care for these incredible bodies that carry us through life. Your ankles can feel normal again. Your legs can feel light and comfortable again. You have the power to make that happen. I'm Dr. Tasuku Honjo, and I'll see you in the next video.